today we are at St. Charles Luanga Primary School in Changamwe Sub-County in Mombasa, where we are providing healthcare services to the community. And it's quite a humid day, it's hot, but this is about midday, about 1 p.m. And so far we have seen almost 2,000 patients, which is an incredible turnout. Not surprising because we have been here before in Mombasa and we had over 5,000. So we are hoping that we can reach that mark again. For today, we are providing them with a number of services from the doctor consultation to lab testing, to triaging, to cancer screening, to also dental and optical services.
So I was notified earlier today about the plight of one Happiness, that she was not able to come to the camp. And of course, as we do these camps, we get those situations where some clients are not able to get to these given camps based on the immobility, the location and all that. But now basically what we've done is we've managed to come, assessed her situation and treated her at the bedside and presented all the medications that she required for today at her bedside. We were able to give at least medication supply for 2 months based on her condition. So basically, Happiness has a chronic wound on her leg and she's had multiple fractures. I've just seen some images for open reduction, internal fixation on the bones that she has by the bedside. But on top of that, of course, when they are immobile, they tend to get these wounds, multiple wounds on the sides. So she has a chronic wound that has been there for at least 2 years or now. Yes, and she's not able to get the medications. So basically, we came from that point of finding a way to at least pay her share for the rest of the year in the list of patients that the M-Pesa Foundation sponsors. So I took her details. The means testing is being done, and we'll be able now to register and pay for that. But basically, we've managed to give her, to dress that given wound, clean and dress. I did some debridement, cleaned the wound and dressed it, and provided her with medication, just antibiotics to aid in faster healing of the wound. I left the supplies that would be able to support the daily cleaning of that wound and dressing. What I'd want to say about the medical camps and the effect it has on those who are able to come to the camp and those who are not able to come to the camp. We can always move to the patient to ensure that these services, these essential services that the patient so desire or need, they're able to get them at their comfort. So we also urge the community and the CHPs as her for keeping us aware of these other patients who are not able to get to the camp so that they don't feel neglected.
Nashukuru sana kuwa associated and to be part of one of the patients ambaye nilifika hapa in the morning, very early in the morning by around 5:30 na nikawa number 1. Actually mimi ndio number 1. Nimeshukuru sana, nimekuwa attended from registration. I went to see the doctors, from the doctors I went to see the specialist. And then I ended up kwa wale wanaitwa M-Pesa Foundation, Zuri. I met excellent staff ambao wamenisaidia sana. I'd been here earlier kwa hiyo kampi yao na nikaambiwa cardiologist amekuja, so I had to leave the camp niende kwa daktari. Nikarudi, imagine they could still remember me na wamenisaidia sana, and now I'm a beneficiary of the 20 people who have been assisted kulipiwa SHA for 1 year by Safaricom.
I would like to thank M-Pesa Foundation and Safaricom for the services they're offering us in terms of communication. And for today, we are seeing them doing something extra in the form of CSR, that is corporate services to the wananchi. They've given us an opportunity to check our health status. Some of us, of course, never knew whether we had some ailments, but today there's an opportunity for everybody who has come to this camp to know whether he is fit and if he's suffering from what ailment and maybe the necessary treatment to follow. Secondly, we are also very thankful to them to give us the best, health services we've ever had since we started these medical camps, in the sense that they are registering our members for SHA. They are also giving them an opportunity to know their status in terms of health. That is, of course, something that we are very thankful, and they're also giving them medicine. Thirdly, they have also come forward to give us some services in education. Yesterday we were at Portree's School for the Physically Handicapped, and they are assisting us renovating Portree School for the Physically Handicapped, which was built 35 years ago, to renovate it to a standard which is going to be very much acceptable to all of us. And there is an indication that they may also pump in some extra money to do the remaining sections that, of course, need also to be repaired.